What's up, guys? It's Dr. Kenny, and welcome back to Neurosketch. I promised you questions, and I'm here to make it right. I'm here to make it right. So I have a question here, and we go straight to the question. Is based on extraocular muscles and all other knowledges that may be applicable. So that's the question too. The patient can move his eyeballs normally and see distant objects clearly, but cannot focus on near objects. So this condition may indicate damage to which of the following structures? A patient can move his eyeballs normally and see distant objects clearly, but he cannot focus on near objects. So this condition may indicate damage to which of the following structures? A ciliary ganglion and oculomotor nerve. B, oculomotor nerve and long ciliary nerve. C, short ciliary nerves and the ciliary ganglion. And D, superior cervical ganglion and long ciliary nerve. E, oculomotor nerve, trochlear nerve, and abducens nerve. So think about that one. Think about this question. You can pause, of course. You can pause and try to give it a thought, or you can, I will answer. I will start solving this question in 5 seconds. And 1, 2, 3, 4, 5. So let's solve the question. So number 1. Now listen to the question. The question tells you. A patient can move his eyeball normally. So the eyeball, they move normally. So if by just saying so, we now know that what are the nerves that are associated with the movement of the eyeball. So that will be your cranial nerve number 3, cranial nerve number 4, and cranial nerve number 6. So your 3, 4, and 6 are completely fine. They are completely fine. This is why you can move the eyeball normally. This is why the patient can move the eyeball normally. So by just saying so, we now eliminate the oculomotor nerve. Is not the problem. So if you see the oculomotor nerve in the option, that is not the problem. So you eliminate. So so this is out of choice. Oculomotor nerve is out of choice. And we see oculomotor nerve, trochlear nerve, and abducens nerve. So all of these, they have no troubles because the eye is moving normally. Because you have normal. Otherwise, we have already seen the pathologies concerning the oculomotor, trochlear nerve, and the abducens nerve. So by just saying so, by just leading this very first part of the question, you know that we eliminate all these 3 options, and then we remain with the 2 options: the short ciliary nerves and ciliary ganglion, as well as the superior cervical ganglion and the long ciliary nerve. Okay, so the first part of the question is almost solved, 75% solved. So what do we need to know from the question? And then listen to the question again. This patient, what is the problem with the patient? The problem is he cannot focus on the near objects. He cannot focus on the near objects. I know it is a little bit like mingled with other pathologies, like other knowledges, the knowledge of accommodation reflex, But we have 2 options. We have short ciliary nerves and the ciliary ganglion, of which if you pay much attention, you will know it is concerned with parasympathetic component. And then we have superior cervical ganglion and long ciliary nerve. And the superior cervical ganglion, you already know that is a sympathetic component. But what do you need when you want to look at the near objects? Remember, if you want to look at something that is very close to you, of course, I told you we have like convergence of the eye, but also what about the pupils? What about the size of the pupil? So when you want to see the object which is close to you, you don't need to dilate your pupil, because the object is here, so I can see it clearly. So the pupil will constrict so as to focus on something that is near to you. But if you want to look at something that is distant, it's far away from you, you need to dilate your pupil to get enough amount of light going through your eye. So if this patient fails to see this thing which is close to him, it means he cannot constrict the pupil. it cannot constrict the pupils. And why would someone fail to constrict the pupil? And that is failure of the parasympathetic component of the pupillary reaction. And the parasympathetic component is carried by the ciliary ganglion, and the short ciliary nerves. See again, one more time. You see the pupillary reaction. I mean, you are solving different questions, and every question you touch on the visual system, it is about the pupillary size, how the pupil react to light. So we need you the knowledge of the size of the pupillary reaction to solve different questions when it comes into visual system. Because this now it was talking about the extraocular muscles, and all of a sudden we are moving to the pupillary size. So pupillary reaction is very, very, very important. Now that you know that if we want to see something is close to you, you have to constrict your eye. Then you know what you need is the parasympathetic component, and so failure to have the parasympathetic component, you will fail to focus on near objects. And so this is to say that the superior cervical ganglion, the sympathetic component, has got no trouble. It is completely fine. And so the damage, the object which has got trouble, it is the short ciliary nerves and the ciliary ganglion. The short ciliary nerve and the ciliary ganglion, that are the one that will bring in information to constrict the pupil so as to focus on the near object. But let me take you back. So that will be the correct answer. So let me take back here. Remember the pupillary reaction, we had the ascending fibers. They were carried within the optic nerve, and then the descending component, the efferent pathway. The efferent pathway was taken through the cranial nerve number 3, which is oculomotor nerve. So the oculomotor nerve carried the preganglionic parasympathetic component to the ciliary ganglion, and then from the ciliary ganglion, the information were taken by the short ciliary nerves to go to the pupillary constrictor, the constrictor pupillae. Okay, so because this patient fails to constrict the eye, so the problem could be on the descending component of the pupillary reaction. That could be carried by the oculomotor nerve, the ciliary ganglion, or the short ciliary nerve. But I have told you, the question has already told us that the patient has got no trouble with the movement of the eyes, because if we had the damage at the oculomotor nerve, the patient would have the down and out deviation of the eyes, and that is not the problem with the patient. The patient can move the eyes normally and has got no trouble. So anything from the ciliary ganglion all the way to the short ciliary nerves will bring the troubles with with constriction of the pupil, and so the patient will fail to focus on near objects. Okay, the patient will fail to focus on near objects. So fellas, that is it on this question. And if you find it helpful, don't forget to like and share with your fellow, and see you next time. Stay tuned, because I'm always releasing these stuff. So see you next time.